And that music means it's time for Talk of the Bay. But first, I'm Rachel Ann Goodman along with Howard Feldstein, and we're going to remind you that we are in day 4 of our fall fundraiser.
But I wanted to say I was so excited when I read that K-Squid was expanding and adding another signal so that Monterey County was better able to hear you. I think it's great what you guys are doing, and I really support it. I think local radio is a really important way to share stories and build community.
Well, thank you. We agree, and we're really happy to be able to connect with you. And congratulations on about to have a ribbon cutting. I know what it's like because we just cut a ribbon in May for our translators, and you're opening a shelter for women. Talk about the need that inspired this shelter. And I understand it's November 4th where you're doing your ribbon cutting.
Yes, so we are opening the first Monterey's first shelter for homeless, unaccompanied women and families with children. And there is a big need for shelters like that. It's the second one we're opening. The first one is in Seaside, a neighboring city. And I recently heard the story about the first day that we started taking applications for that shelter. We were opening the applications up by phone at 10 a.m. And so all the staff were gathered together, all the phones were gathered together. And at 10 a.m., every phone lit up. Every single phone lit up, and it was unrelenting all day long. So there's an incredible need. There continues to be a wait list of over 200 homeless women and families waiting for shelter. And, you know, we're happy that we're able to open this one, which has, I believe, 35 beds to help people. There's continuing to be a need for more, but we're just continuing to press forward.
That really, just hearing you say that there were so many women and children living unhoused, it was that made almost made me want to cry thinking
Yeah,
about people sleeping with their children unsheltered. What
absolutely.
it's a public health emergency, isn't it? And you're just
It is because homelessness is really bad for your health.
yeah.
And the people's health deteriorates rapidly when they're homeless. And there are now many, almost half of, I think, solo homeless folks are over 50. So if you can just imagine having arthritis and other health issues already, and then you're sleeping on a cold sidewalk or someplace, it's really something nobody would wish on anyone else.
Absolutely. Your shelter with 35 beds, how long can someone or someone with their family stay there? I know it's a temporary arrangement, but what is the farthest extent someone could seek shelter there at your new shelter?
Well, the standard time is 90 days or 3 months, but on a case by case basis, people can stay longer. It really depends on what their situation is. And we don't just supply a place to lay down your head. We have case managers who help people find work, find treatments they might need, health or mental health or substance abuse, what have you, counseling. We connect them to other resources. And then we also provide a rapid, what's called, I think, rapid rehousing assistance. And what that means is that we will pay their first month's rent or their security deposit or their first PG&E bill. I don't know if you've gotten a PG&E bill lately, but it's a lot. Because if you think about it, in Santa Cruz or in Monterey County, if you pay first, last, and security deposit, $2,000 a month, which barely gets you a one bedroom, that's $6,000.
That's a lot of
That's a
money
lot of
for
money to have on
anyone.
hand. And if you're homeless, you don't have that money on hand. So there's very simple, there's simple ways that just involve providing that money that ensures people can find their forever home, get back on their feet and so forth. That's also how we can help people not become homeless in the first place. And that was one of the findings of the recent and recommendations of the recent homeless study that was done by UCSF, which was very powerful, and it was the biggest study done since in the United States since the 1990s.
Did
Very
it talk
powerful.
about the effect of the temporary child tax credit that was happening during COVID and also eviction prevention that happened during COVID? Because once those ended, it seemed like homelessness and poverty skyrocketed again, but it was not a very
Right.
large amount of money. It was like 400 or 500 a month, but it lifted huge numbers of families out of poverty. Has there been any part of that study that mentioned that kind of experiment that was done and why it wasn't continued?
I haven't read the whole study, I confess. I did attend a webinar on it, but I'm sure they did mention it because it covered the past they did it over the past 2 years, so I'm sure they saw that. And I
Right.
just wanted to back up a little and say, when I say we, I'm talking about the organization I work for, which is called Community Human Services. It's a nonprofit in Monterey County. We've been around for over 50 years, and we actually provide services for low and very low income people in three areas that are often very connected: homelessness, substance abuse, and mental health. So we provide access to those services for free or very low cost for folks in Monterey County.
That's great. And how do you get your funding? It seems like a lot of money to spend $6,000 to get someone in a home. Where does most of your money come from?
Well, that's always a good question. And actually, the services we provide around substance abuse and around mental health are covered for the most part by government grants, contracts, and things like Medi-Cal. But interestingly, the homeless services we don't are not covered. So we have recently expanded our fundraising department. And sorry if you heard a bloop. Um, so that we can raise money from the private sector as well, especially for continuing to operate shelters.
Right.
So the Shuman Hearthouse is the shelter that's opening on November 4th. It's actually named after a very generous and very committed advocate for people who are unhoused. His name is Mark Shuman, and he is a real estate developer, and he actually actively looked around Monterey for the right place for a shelter. He knew that there was a need for one. When he found the right place, he bought it and then basically donated it to us. It was more complicated than that because that's how finances are, but he was responsible, and he donated over $3 million to get this new shelter going. And then the rest of the money came, we got about $2.5 million from the state, thanks to Senator John Laird. And the rest of it came from foundations and donors, in large and small amounts. We have a
That's
huge
great.
list of donors.
Wonderful. I'm speaking with Megan Whilden, and she's with the Schumann Heart House, a brand new shelter for women and children opening in Monterey on November 4th. And it's a miracle, really, that this many people came together. But it's not like people don't recognize the problem, they don't always know what to do about it. I was wondering if there was
Exactly.
any trouble locating it because we often, think it's a great idea to have a shelter and then people in neighborhoods don't want it there for whatever reason. Was there any trouble there in that department? I know here there's been a couple examples of trying to locate, housing for mentally ill patients. People don't want it. And so,
Mhm.
how did that go? Was it accepted in the neighborhood where it's located?
I am not aware of any pushback to it. I hate to even say that because now I have to knock on wood. But I think that it has been well accepted, and I think a lot of that is because there's been a campaign to raise awareness, especially about homeless women in the Monterey Peninsula over the past 10 or 15 years. And that has really educated people, touched their hearts, and inspired them to do something about it.
That's really wonderful. One of the myths we often hear repeated by people who maybe don't understand the issue is that if you provide, a shelter like the one you're opening, people will move here to take advantage of it. They'll move to Monterey because there's a shelter. Do you
That's
hear that kind of
false, false,
criticism?
false.
Right. Would you like to dispel that myth for us?
Sure, thank you. That's been proven false over and over again, both in our local surveys where almost everybody here is local, um, and also in that UCSF survey that I mentioned, the same thing. What is the cause of homelessness, plain and simple, is the skyrocketing cost of housing and the lack of affordable housing. There's not enough housing to go around, and then the prices go up, and people, one little thing can just tip them over into homelessness.
Yeah, I was wondering, if the cost of a house, I think you mentioned it was $2,000 for a one bedroom. Are they fairly comparable all around the Monterey Bay? I'm pretty sure we got the unfortunate prize of Santa Cruz County being the most expensive place to live in the nation, but I think Monterey must be a close second.
Yeah, we're very, very close to you. And it might be, slight in Monterey County, it's a bit less expensive in Salinas Valley, but still compared to much of the United States, it's terrible. I was just talking to someone about an encampment in Salinas, and they said 40% of the people there are farm workers. And the housing, even when there is housing for farm workers, it's often so substandard, so horrible that they would rather sleep in the open. They would rather, you know. So there's, a homelessness in every community. Um, and it's an epidemic. And I used to work in Carmel, which is, you know, perhaps one of the fanciest parts of Monterey County, and you don't think you see homelessness there, but in fact, there are homeless people in Carmel. There's an encampment in Carmel. It's just hidden from the folks. So if people don't see it, then they don't think it's there. And that was the challenge with homeless women, because homeless women are so much more vulnerable for the most part than homeless men. And so you don't see them, they hide, they have to stay hidden and not visible to protect themselves. So here in the peninsula, people didn't even think there were homeless women until, a study was done, and there was actually art projects that were done that made them visible. And once they were visible, people wanted to help them.
That's really your story at the beginning of our interview, still ringing in my ears that you opened the phones, and you'd probably done some outreach telling people that there was going to be a lottery or however you decided, first come, first serve, and your phones lit up all day. And then there was a 200-person waiting list. That
Yeah,
just tells you what a problem it is. And
exactly.
what other places, do other people have to go? I mean, obviously, this particular shelter is for women and their children. Uh, where else do you refer, single men or men in general?
Here on the peninsula, there's several organizations. There's an organization that runs parking lots because a number of homeless people live in their cars, working or non-working. And so for working cars, there's often parking lots. They're often actually in churches. You probably have that in Santa Cruz, where people, especially women, can park and feel safe overnight. we have a coalition of houses of worship that take turns bringing folks into their house of worship to sleep between the pews, and each night it's a different location and they provide them dinner. So there's a variety of offerings, but there's absolutely not enough of them.
Yeah.
But I do think that with the crisis, that people are becoming more creative in their responses and there's more willingness to think outside the box.
It's got to happen. I mean, you can't just keep on having a society where large populations of people are sleeping under overpasses. It's a failure of our safety net system, and you don't see that in Europe. I spent time in Ireland this summer, and only in the big cities did you see people sleeping in doorways, and even then, it was one or two. You just don't see it. So that means there's a safety net there that keeps people out of abject poverty or in housing. Some places have universal basic income, for example. We haven't
Absolutely.
yet figured it out here in California, but I'm glad to hear, that people got together privately and created this shelter, the Shuman House, Hearthouse, and again, that's going to be available for people who need shelter. There's a waiting list. Do you want to give out your contact information in case anyone knows someone they would like to refer there or they themselves would like to take advantage of your services?
Absolutely. So if people want to get on the waiting list, they can call the following number. It's 831-867-8200. And the application process is over the phone. You don't have to fill out a form and so forth. And my understanding is the selection process is a combination of need, where people that are, for example, domestic violence, people in domestic violence situations are almost always, go to the top usually because their life is in danger. And those different kinds of things are taken in consideration.
Wow, that's amazing.
Where, because, I mean, if you get into the minutia of it, homeless, you does not always mean unsheltered. You might be sleeping on someone's couch and so forth. But unsheltered is definitely the most dangerous for the individual on so many different levels.
Well, Meg, I want to thank you, Megan Whilden of the Schumann Heart House, a brand new shelter for women and children opening up in Monterey on November 4th. Thank you, and do keep in touch.
Thank you. And people can find more information at chservices.org.
Thank you so
Also.
much for being here and sharing with us. I
Thank
appreciate it.
you. Thanks for all you do.
All right, we'll be in touch.